The Ministry of Health and Family Welfare and the Ministry of Home Affairs, Government of India, have announced guidelines for the state governments to give focused attention to and ensure protection and safety of persons with disabilities. The measures will be explained shortly. During the lockdown period, to avoid sufferings of persons with disabilities, the Government of India has issued guidelines to be followed by the union territories and state governments. For persons with disabilities, all information about COVID-19, precautions to be taken, and services offered should be made accessible. For example, for persons with visual impairment, the information should be available in audible format and in braille. The information should also be available in simple and local language. For persons with hearing impairment, the information should be available in videographic materials with subtitles and sign language interpretation. Point 2. Healthcare workers dealing with COVID-19 in emergency and health settings are given various health and safety protections. Similarly, for sign language interpreters who are required to provide interpreting in emergency and health settings, the government has announced that they should be given the same health and safety protections. Point 3. All persons responsible for handling emergency response services including COVID-19 should be trained on the rights of persons with disabilities and on risks associated with additional problems for persons having specific impairments and how to work with them. Point 4. All awareness campaigns should include relevant information on support to persons with disabilities. Point 5. During quarantine of persons with disabilities at home, essential support services, personal assistance, and physical and communication accessibility should be ensured. For example, for persons with intellectual or mental disability, caregiver support must be provided. Similarly, persons with disabilities may seek assistance for rectification of fault in their wheelchair and other assistive devices. Point 6. Caregivers of persons with disabilities in different locations should be allowed to reach the persons with disabilities by exempting them from restrictions during lockdown or by providing passes. Point 7. Some caregivers and other support services for persons with disabilities require close contact, for example, persons with visual impairment. For such cases, to prevent COVID-19 infection, government must ensure provision of personal protective equipments for caregivers. Point 8. The resident welfare associations must allow entry of maid, caregiver, and other support providers to the residence of persons with disabilities. after following due sanitizing procedure. The resident welfare associations should be sensitized about the needs of persons with disabilities. Point 9. Persons with disabilities should be given access to essential food, water, medicine, and other essential items. Additionally, for persons with disabilities who have been quarantined, such items should be delivered at their residence or place where they have been quarantined. Point 10. For persons with disabilities and older persons, the states and union territories may consider reserving specific opening hours in retail provision stores for ensuring easy availability of their daily requirements. Point 11. For persons with disabilities in quarantine, peer support networks may be set up to facilitate support, discussion, and sharing of experiences to alleviate stress. Point 12. During the lockdown period, for persons with disability who need to travel due to urgent reasons, travel pass should be provided. They should be sensitized for their personal safety and protection, and additional protective measures should be taken for them. Point number 13. Persons with disabilities who may require treatment should be given priority in treatment. Special care should be taken in respect of children and women with disabilities. Point 14. Employees with blindness and other severe disabilities in both public and private sector should be exempted from essential services work during the lockdown period, as they can easily catch infection. For persons with disabilities under quarantine, online counseling mechanism like emails, video calling, etc. should be developed to de-stress persons with disabilities. Families should also be provided with online counseling to cope up with stress during the quarantine period. The government has issued guidelines in this regard. Point 16. For persons with disabilities, to ensure communication accessibility, a 24/7 helpline number exclusively for persons with disabilities should be set up. The helpline should have facilities of sign language interpretation and video calling. This is to be done at the state level. Point 17. The states and union territories should ensure the preparation and dissemination of information materials on COVID-19 for use of persons with disabilities. To resolve disability-specific issues during the period, the government has assigned the responsibility regarding care and management of services for persons with disabilities to the state commissioners for persons with disabilities. The government has announced that the respective state commissioners for persons with disabilities should be declared as the state nodal authority in respect of persons with disabilities. The State Commissioner for Persons with Disabilities should be the overall in charge to resolve disability-specific issues during the crisis period. They will coordinate with the State Disaster Management Authority, Health, Police and other line departments as the district collectors and district level officers dealing with persons with disabilities. They will be responsible to ensure that all information about COVID-19, public restriction plans, services offered, etc. are available in local language in accessible formats. The government has announced that the district officer dealing with empowerment of persons with disabilities should be declared as the District Nodal Authority in respect of persons with disabilities to oversee the protection and care of persons with disabilities. The District Nodal Authority of Persons with Disabilities, who should have a list of persons with disabilities in their district and monitor their requirements periodically, and should have a separate list of persons with severe disabilities who need high support. The District Nodal Authority for Persons with Disabilities will be responsible for resolving the issue within the resource available, and if necessary may take the help of NGOs and civil society organizations or residents' welfare associations.